Why did the price of EpiPen increase 500% over the past decade?
Because we realized there was an unmet need. And so we made a conscious decision. The board, we put a business plan together to invest, to build public awareness and access. We are now in over 70,000 schools across America. We've donated more than 800,000 free EpiPens. And remember that that price incorporates the entire supply chain. But it was that investment over the last 8 years that would allow us to reach patients and save lives.
But you're saying that because you wanted to make it more accessible, it had to get more expensive.
Yes, that price went up because we were making the investment, as I said, about $1 billion over the last decade that we invested in the product, that we could reach physicians and educate legislatures. But then you also invest in the supply chain to make sure that, that employers, that employees, that everyone has access to have our medicine. Last year, 90% of EpiPen patients paid less than $50 for EpiPen.
But the list price is $600.
Yes, which is why I've said that if EpiPen needed to be a catalyst to show the system is broken, then so be it.
But I don't have to tell you, because you witnessed it in Congress, but there's a lot of patients at home who say it's pharmaceutical companies like Mylan that are the ones getting rich.
No, absolutely, and I understand that. And that's why I said I get the outrage, because it is so complicated and so complex, and the only face that you see on that medicine is the pharmaceutical manufacturer, where in reality there's at least 5 entities touching that product.
In fact, Bresch says that for every $608 EpiPen 2-pack, Mylan receives 274. The remaining 334 go to other players in the supply chain, middlemen including pharmacy benefit managers, or PBMs. The president of the National Association representing America's PBMs told us that Mylan stands out for its refusal to accept responsibility for its own high prices. PBMs, which reduce prescription drug costs by 30% for employers, unions, public programs, and the patients they serve, are part of the solution.
President Trump has said that pharma is now going to have to address the high drug prices. He's demanding change.
And I couldn't agree with him more. And I'm looking forward to it. I think if we've ever had a moment in time or administration that is willing to be disruptive, I think President Trump has shown that he is willing to make tough decisions, hard decisions, but right decisions.
So you would support the change in the law that would allow the U.S. government to negotiate drug prices for Medicare and Medicaid?
No, I don't know that that's the answer. What I would support is that we look holistically at how pharmaceutical pricing is done today and what is the best way to make it market-driven and give transparency to the patient walking up to that counter, that they know what they're buying.
So who are your allies in this effort to fix the system, the pricing system?
It's going to be a coalition of a lot of interesting groups. Employers. Employers are frustrated. Employers know their health care bills going up and up, and they're hearing from their employees who are dealing with these soaring deductibles. So I think the administration is going to be an ally, and I hope every mom out there is an ally. As I said, I can't do this alone, and I don't have all the answers, but what I can tell you is I'm going to work tirelessly to get the right information and to strive for that transparency that's much needed in the system, and to make sure that patients can have the medicine they need.